Welcome to an edition of Pimping the Expert, where we take a time-honored tradition that all trainees love and flip it upside down. I've taken a series of ultrasound video clips and I've blinded our experts to them. So let's see how they interpret and see what pearls they can drop right onto us. Julianne, what do you got?
Okay, well, right now I see something that we like to call a WES. Looks like a nice bright hyperechoic gallbladder wall with a big echo or a big shadow right below it. Called a WES, wall echo shadow sign. Means there's a big ass gallbladder, maybe a couple little guys in there that are like filling up the whole thing. But we don't see a lumen of the gallbladder, and this is basically just a sign of cholelithiasis. Again, more of that. This looks pretty similar to me. I'm seeing the same thing. I see the wall, I see a little bit of an echo, and I see a shadow. Don't see any fluid or signs of surrounding inflammation. Doesn't mean they don't have cholecystitis, but we can let the surgeons take them and figure that out. I'm seeing a nice gallbladder. Anterior gallbladder wall doesn't look particularly thickened. I see a nice bunch of stones sitting at the bottom, creating a shadow. And that's about it. Just waiting to cause trouble in the future. Sky, pretty similar. Lots of shadows from those hyperechoic stones. The gallbladder wall doesn't look particularly thickened, and I don't see any fluid. I would still call this cholelithiasis. Unless they've had a sonographic Murphy's, but of course we all know if they've had pain meds, no one's going to say it's positive. Next, this, however, I'm seeing a nice, that hyperechoic line, that's the anterior gallbladder wall, but I do see some fluid around it, a little bit of a anechoic pericholocystic fluid, and with that shadow that indicates gallstones, I'd probably call this cholecystitis if the clinical picture fits, but I would correlate clinically, of course, as I do as an ER doctor.
Per radiology.
And here again, actually nice view of that pericholocystic fluid with those gallbladder or those gallstones there. Maybe a little thickening of the wall. I'd have to slow it down and measure it, but it does look a little bit bigger than the classic 3 millimeters that you would expect to see. And here I'm seeing just mostly what I would think to be cholelithiasis. I thought maybe I saw a little fluid, but for the most part it looks like a pretty normal sized gallbladder wall, and I don't see a lot of fluid around it. Not getting a great view of the common bile duct. I see the duodenum, and I don't see a gallbladder. Here, shadow from a stone, probably lodged in the gallbladder neck. That wall looks okay. Again, cholelithiasis. Thank you, Mike Schick.